website. So if you, hey, it's your afternoon girlfriend, Yvonne Daniels. Happy Tuesday. Hope you're having a great day. And just thank you so much for joining us for this special live stream. We are doing it for Big Ma again with the Saginaw County Health Department. And I've got the health director, Dr. Delisha Pruitt with me, and health officer Chris Harrington. How are you ladies doing this afternoon?
Great.
Thanks for having us, Yvonne.
And, you know, it's a pleasure to have you ladies and Dr. Pruitt. You know, we were talking last week, just talking about this whole Do It for Big Ma campaign, just trying to make sure that people continue to mask up, that we continue to stay safe and social distance, so that we can get these numbers down and keep them down. Today, we want to talk about something that's going to be very important coming up. Election. We've got the public health millage that's going to be on the ballot that we want people to know about, make an educated, decision voting for. So we've got some information that we're going to be sharing today, so folks can do that. So, want to ask the question, and Dr. Pruitt, I will ask this to you: why is a public health millage even necessary? Isn't the county or state supposed to kind of pay for those services that you all offer?
Yeah, so I think that this is really necessary because the state does give us money, but it's not enough. And I'm going to ask Chris to go through a little bit more because she's been here for many, many years at the health department and to tell us a little bit more about that.
Okay, thanks, Yvonne. Thanks, Dr. Pruitt. I have been at the health department now for almost 17 years. So I've worked largely my entire career in public health and have seen our budgets decline and decline and decline. And so when you ask the question of, it's a yes and a no answer, actually.
Okay.
So yeah, the county and the state is supposed to help fund public health, and they do. We get federal dollars, we get state dollars, and we get some local dollars. The problem is that with public health, we haven't had enough funding to maintain what we've needed to do, not only what we're required to do as a local department, because actually we are required by law to provide some services, but it's also what we need to do in our community based on our community's needs. And that's whenever we get any funding. And so we struggle with that. So when the state and the federal dollars are like stagnant over time, we know that 20 years ago, those dollars went a lot further than they do today. So unfortunately, we can't have the same level of staffing that we need to have for our population of our size in Saginaw. And so it's the yes and the no answer really to that question.
Right. And you guys do such great work, and we're going to be talking about that a little bit. But continuing on with this millage, so how much is the millage going to cost the average homeowner in the county? I know a lot of folks are wondering about that. So
for the average homeowner, if you have $100,000 house, it's only $2.08 per month. Okay. Over the whole year, it's like $25. And I want everybody to know, I went out to McDonald's with my kids. I personally didn't eat it because I don't like McDonald's. So I went out to McDonald's, and 4 people cost $25. So we're just saying one McDonald's meal is the same cost. And so we want people to know we're not trying to put a lot of pressure on people to spend a lot of money. It's just a little bit of money to help us through to get to those services that we really need.
So what is this millage going to pay for exactly?
So the millage is really designed to pay for a couple really key things. One is for us to have sustained sort of mobile operations. So we have cut back service delivery so much in our county that we just have all of our services under one roof. Okay. And what we've learned is that nowadays people need services that are convenient and accessible to them where they live. So mobile units, we're hoping to get 1 to 2 mobile units that we could get out into the community where we could just go up on a street corner or in a parking lot or at a school or at a health fair and be able to offer some services that would be convenient to everyone if they live, work, or play anywhere in Saginaw County. So that's one of the things. Another one that's really important is to say, I've heard some people like, well, I heard it's an epidemiologist, and what the heck is that? And so what we're hoping to get is an epidemiologist on staff, which is a person who studies disease trends. And throughout the midst of COVID, we know that everybody's fixated on all the numbers and all the data, right? What's the positivity look like? How many cases do we have? How many deaths? I mean, we've been doing this for 7 months. And so what we need is an epidemiologist who will study those disease trends, help us look and dig down into that data, not just for COVID though. This position would be sustained with the millage and would allow us to dive into, we all know that our health outcomes are not great in Saginaw. We have higher than average cancer rates, particularly in the city and some of our even rural areas in relation to some heart disease, some cancers, breast cancer, for example. We also have high asthma hospitalizations in our county, much higher than most places in the state of Michigan. So that's another thing that we're trying to, if we had an epidemiologist, we could dig down into that data a little bit more to figure out what of these things are occurring so that we can stop them from happening in the future. So those are a couple of things, but we have others too, with expanding our nursing staff, expanding our laboratory to do more testing, more robust testing, not only just from a clinical standpoint like COVID and influenza, but things like water quality and that kind of aspect. And then just, enhancing communication so that we can stay out. A large part of what public health does is ensures that we're educating our residents about the health issues like COVID or like flu or like whatever the disease next comes. So we need to be able to do that moving forward.
Oh, I hate to hear that. Whatever the disease, whatever next comes up.
I know. But there will be.
Yes. So, you kind of alluded to a few things. A lot of people may think, if I don't go down to the health department building ever, and I don't use health department services, why should I pay for something that I don't use? But you're just explaining that really the Saginaw County Health Department, everybody kind of uses your services.
Right. You don't know that you're using them.
Right.
You're using them. So if you go to a restaurant, we do restaurant inspections. And so we make sure that you're healthy when you eat at a restaurant. That's really important. And you say, I never use it. You use that service. What about mosquitoes? We are over that, the mosquitoes. And, mosquitoes carry a lot of different diseases. We talk about the triple E that people all talk about. Well, we help with mosquito abatement. What about if people own a well? We do well water testing. If you go to a swimming pool in Saginaw County, all around the city, Frankenmuth and all different places, there are different pools that you go to. We test the pool water. So you say, no, I never experienced the health department. You truly have. What about your kids got an eye exam and a vision eye exam and also a hearing exam or hearing test at the school when they were in school? That all came from the health department. We ask people all the time, raise your hand if you've ever had any experience with the health department. They don't raise their hand, and we go, did you have a hearing or vision exam? And then they raise their hand, not even knowing those were the people from the health department. If you go to work or visit a public building, we're there, and we're there during a disaster. And like I talked about last week, in the midst of COVID-19, which we are dealing with, we also dealt with the flood disaster in Saginaw County. And we were right there helping to prepare people for that and to and manage that. So when you think about it, you touch the health department, and the health department touches you more than what you think.
Definitely. As you go to and make your choice on the ballot on November 3rd, or if you've already done so. So thanks for helping to kind of help us to understand, what services you all offer. And Chris, now I think you said you've been with the health department for, is it 17 years?
Yep.
You've been there for a while. So why do you suppose people still don't fully understand how the department serves the county, even as we're in this pandemic?
Yeah, for as long as I've worked there, when people say you work at the health department, they're like, what is that? Because we're not a traditional doctor's office, right? You don't come here for an annual exam. You don't, call us up to get in to see Dr. Pruitt. So what the services we provide are like safety net services. So I think like, oh, okay, well, if I don't need that, then I don't need the health department. That's really not true, because a large part of what we do is we're preventing disease from happening. So we, just as Dr. Pruitt said, so we're testing people's water to make sure that when they're swimming in the swimming pool, it's not going to make them sick. Or we're inspecting your restaurant so that when you go out to eat somewhere, it's not going to make you sick. So we're preventing disease. So when you prevent something from happening, then you don't realize that it would have happened to you, right? So we say we're like sort of the best kept secret, or that when we're doing our job, we're just very much behind the scenes in that regard. And so I think that there's a lot, anytime we've had medical residents come through, we've had community groups come through, we talk to community members, and once they say, wow, I didn't realize that those are all the things that you guys did in this community. Yeah. Some of those things are upfront, and some of them are very much behind the scenes because it's prevention. And that doesn't mean that that's not really important work that's happening. And so we just want people to know that the health department, I think now through the lens of COVID, they've heard terms like public health, they've heard terms like the health department. Know that that's just one disease out of almost a list of 100 that we investigate on a daily basis to make sure we don't have additional spread in our community. You know, we do outbreak investigations in restaurants, in nursing homes, and congregate settings like schools. We've been doing that since the beginning of public health, and that's really what started public health, was looking at cholera in the water and TB cases, and how do we limit the spread in our community. That's really what public health does, and those are the things that we do, but people just don't know about them.
And now the secret is out.
The secret's out, yeah. We don't want to be the kept secret, like unleash the secret.
And what do they say is, okay, forgive me if I don't get this correct, I think it's an ounce of prevention is more than a pound of cure, or something like that.
Yes, very good. Absolutely, yeah.
All right, so now Dr. Pruitt, you're relatively new to the health department. So tell me, what surprised you most about what the department accomplishes?
Well, you guys, one of the things that you guys don't know about the health department is that we have a lab here, and the lab has been helping, let's say, at the nursing homes to test the nursing homes, for doctors' offices, and we have a rapid test here that we use for doctors' offices so offices can stay open during COVID-19. They do urine drug screens, all kind of things here. They have something called family nurse services, where the nurses actually go out to the new mothers' homes to help them out. They have immunizations here, environmental health here, emergency management. There's a whole team of people who get together in the time of an emergency. We have a WIC here that helps mothers and children during their pregnancy and afterwards, up to 5 years old. And then one of the coolest things they do here is, with the hospitals and all the stakeholders come together, they do a community needs assessment. It was the first time I was a part of this needs assessment. They take people of the community, hospitals, all kind of people who want to come and find out what are the needs of the community and what are the things that we need to focus on in our community. Like, who knew, right? And this is published every 3 years. This comes out. And we get to decide what we think is important for our community. And so these people are all in the background working really, really hard to keep people safe. And the problem is, like, if I keep you safe and you're safe, you don't know that I'm doing my job. And my job is for you not to know that there's something terrible out there. So just know that just because you don't see it, we're safeguarding you. We're making sure that disease doesn't come to you, and we're constantly watching it to try to make sure that you are safe in Saginaw County. And that's what we do. And sometimes people don't know it because we've been keeping you safe.
And we just talked about not wanting to be the best, kept secret or a secret at all. But man, we thank you so much for what you've done. But of course, with the pandemic, a lot of things have been, discovered. Layers have come off. We, know about a lot of things. So, with saying that, would you all be asking for this millage if it weren't for COVID-19?
Yeah, I would say yes, because you know what? COVID-19, what it did was put a little bit more pressure on an already tense system. So we have 7 nurses, that's just it, who are doing contact tracing. They also are opening our clinics to see people too. So you can see that our staff is really, really, they're doing a great job, but it's just they're thin with all the work staff we have and work that needs to be done. So even without COVID-19, we still need more help in here, but with COVID-19, it's put more pressure on the system. So outside of COVID-19, there's still some things that we want to do, but with COVID-19, definitely it is difficult. Chris, you want to add anything to that?
No, I mean, I think you said it well in that our job is to protect everybody from all those diseases. And so with COVID and the resources that we've had to dedicate towards that, we've come to where the rubber meets the road, and that with very little resources that we only have 7 nurses that are doing COVID investigations every day. And that's, we had 116 new cases come Monday morning. Okay. Right. So you just think like the amount of time that takes to carefully investigate each case, to determine who the contacts are. These nurses are spending all their time doing that. And so we can't do both. We can't do all the services like back to school immunizations. I mean, folks are calling and saying, can I get in to get my kid immunized? And we only have so many people and so many dedicated nurses, and they can't do everything. And so we've realized outside of COVID, we were getting to a point where we had appointment-only clinics instead of walk-in services. Our infrastructure has just been dwindled year after year after year, and it's got to a point where it's like we can't continue to meet all of the needs of our community, which is unfortunate. So this millage will really help support not only that infrastructure, but allow the health department to grow and meet the needs, all of our needs.
So you say you only have 7 nurses. So if a millage were to pass and you got the funding you needed, what would you see? How many would you need to kind of service the need that you have, the demand that you have coming in?
Yeah, I think that's a great question. And right now we've got, so outside of COVID, we have 1 nurse that does all of our communicable disease investigations. So whether you go to your doctor's office and you get Campylobacter or E. coli or whatever they test you for that's reportable, we have 1 nurse that does that. So we need to expand that into a team of nurses. So we probably could add at least 2 nurses to that could really effectively not only do outbreak investigations, but every reportable disease. So whatever comes next, right? And guess what? Flu season's starting. So now we got to make sure we're following flu and mitigate that. So that's another element there. So we probably need a couple in that area. Not to mention those clinical services, getting back to walk-in appointments, the mobile functionality that I discussed earlier. So we need probably another 2 to 3 nurses at least. And that's really just being, really realistic in nature. We're not trying to say we need to hire 30 plus people, in public health, we're really used to doing more with less. And so our folks, if you know anybody who works at our health department, how many hats they wear. And, after a time you get burnout associated with that. So we need really dedicated nurses that can do a really good job moving forward. And they're doing the best they can right now, but they need some help.
Yeah, just to relieve some of that tension there for sure. All right. So, and we hope that this does not happen, but if the proposal fails, what can we expect to see and feel?
Yeah, unfortunately, if the millage doesn't pass, then we're really going to have to further examine what are our mandated services. So what does the state health we have to provide? And then all the other things are put at risk. So we're going to see less services in our community. We're going to see less staff. So, and we're not going to be able to respond to COVID like we have, being the educators in the community, being groups, really being out there to educate about every day. We're not going to be able to do that, particularly if we see surges in COVID, flu, or whatever. We're not going to have that capacity. So really, what does that mean long term? That means more disease in our community, worse health outcomes. We've already got, pretty adverse health outcomes right now, and things are going to get worse. If we can't get in and do the inspections and prevent, like we talked about, the really critical prevention, you're going to see more diseases in our community, which we have enough. We're trying to make improvements. We don't want to make things worse in this situation. So, we're put at risk, a higher infant mortality rate, which our infant mortality rate is already too high in our community. And so those are the things that are at risk really if the millage doesn't pass.
We hope that Does not happen. So, and some people would say, we have, and this is a blessing, we have some amazing hospitals and providers here in the Saginaw County. And, folks would say, so why do we even need the health department anyway?
Yes, so I'm going to answer this one. So the health department is a neutral convener. What we mean by that is we're a neutral party that takes all of the different health systems, Covenant, St. Mary's, Great Lakes Bay, Health Source, all the different places that are in our health system, and we bring them together so that we can work together for the betterment of everybody in Saginaw County. So it's not like, so one of the things we were most proud of is that all of our health systems came together and we made decisions together as a team and released those decisions out to everyone in the community. That made me so excited because it wasn't like, this is my area, this is your area, don't step in mine. No, we got together with our strengths and weaknesses together to shore each other up, to make sure that we offered testing, places to go if you were sick with COVID-19. And so I think one of the reasons why some of our numbers were higher earlier on is because we started offering testing early, which helped us to figure out how bad was it in our community. So in general, the health department is here to say, we're not on the left, we're not on the right. We stay in the middle of most issues. Just with us, it's all about keeping you healthy. It's not about anything else. And we stay in the middle, bring all the health systems together so that we can come up with something to keep you safe.
And there's strength in numbers. And it is always great when, when the different, hospitals and organizations can come together, because it is just for the betterment of the community. Just trying to keep everybody, safe and healthy. So with saying that, is there somewhere that people can go for more information? I know that we have up here, we've got the website, so we've got the SaginawPublicHealth.org. What are some of the other ways that people can get resources and information?
Yeah, definitely going to our homepage right there that's listed on the screen. We've got information on the millage specifically, so you can click on a page to get more of the millage information. We've done some mailers as well, and so folks should have gotten like mailers like this that came in the mail about the millage information as well, and we'll be doing some more of those. Then you can also follow us on our Facebook page at Saginaw Health, our Facebook page, and we post all the information down in the millage, all the services, all of our data. It's a really active page. So if you haven't looked at our Facebook page, I would encourage you to get on there. Just search the Saginaw Health Department if you want, and we'll come right up. There's also, other mechanisms on the campaign itself for the millage. You can find those resources as well through those mechanisms.
Okay. All right. Well, this has been wonderful. And, if you're out there watching, we just thank you so much for being a part of this conversation. And remember that you can check this out on our KISS 107.1 Facebook page, also our KISS 107.1 YouTube channel. Be sure that you share it with people, because the more people that understand this and just have a better understanding of what is being asked of you,
Yes.
And that it's not costing a lot, and it's going to do so much help that the Saginaw County Health Department really needs. Just please get that information out to as many people as you can. And I just thank you guys so much. Before we wrap up, before we shut this thing down, if anyone has any questions, put it in the chat box. But is there anything that we missed, anything that you guys to add and just to kind of leave out on?
We always like to leave with the 3 W's, Yvonne, because I know people get so sick of us saying it. We want it to be ringing in your head, right? Every time you see our faces, see something about public health. Wash your hands. Like your grandma always said, wash your hands, wear your mask. If you can't, we want you to do it for yourself, but if you can't do it for yourself, like we keep saying, do it for grandma, right? So do it for your grandma and granddad, that elderly person, and then watch your distance 6 feet away. Don't let people come in and say, I'm outside. I can be really close to people. We saw what happened with our president and the other things that happened there. So we want to do the 3 W's to keep you safe during this time.
Yeah, I think that's a really important message, and we can't stress it enough. These simple strategies, right now in COVID, we're saying, okay, we've been saying wash your hands. We know that just hand washing alone can help prevent the spread of disease. So these strategies all coupled together can help us stay healthy, and that's our goal as a community. So please practice the 3 W's and know that the health department is here as a resource for you. If you have questions, you don't know where to turn, That's what the health department's here for. You can pick up the phone and give us a call, 758-3800. If you're looking for anything in our community, that's what we're here to do. And if it's a resource that you need during COVID, check out our website or give us a call. We have a hotline, and we'd be happy to answer questions because we're here to help safeguard Saginaw.
And one more thing I don't want to say, don't forget 211. You can call them if you need a provider or somewhere to find out testing or anything. 211 is going to be you can call to get some help.
And all of this information is so needed too, especially as it looks like children are going to be going back to school 5 days a week. I know in the township starting Monday. So, hopefully you won't see a surge in, your services being needed. But, if there is it's there.
We've got right here.
Resources, there you go. So once again, Health Director Dr. Delisha Pruitt and Health Officer Chris Harrington, thank you so much for taking a little time to explain the Saginaw County Health Department, and make sure that you keep all this information in mind as you go to cast your ballot for the millage for public health. Thank you, ladies, so much. We do appreciate you, and until the next time.
Bye. Thanks for having us, Yvonne.
Yeah, thank you.
Take care. Bye-bye.
Good job, Kayla. Is Kayla still on? Kayla's gone off. Kayla's off. Kayla gone? Kayla is gone.